Hello, welcome to Sex Ed. Today we're going to cover Lesson 7, which is all about HIV and AIDS. So if you're following along in your packet, the story for this lesson is on page 39. Let's go ahead and read it together. Sonia was about to use her friend's lipstick when someone in the hallway shouted, "Stop! You could get AIDS!" Sonia just laughed and continued to apply her friend's lipstick. She was studying how the AIDS virus is spread from person to person and knew that using someone's lipstick was definitely not how HIV is spread. That evening at the dinner table, Sonia wanted to discuss what she was learning in school about HIV. She began to explain that HIV is only spread by infected blood, semen, vaginal fluids, or breast milk that gets into someone else's bloodstream through their mouth, anus, genitals, either the penis or vagina, or cuts in their skin. Sonia's older brother added that doctors also worry about getting blood splashes in their eyes. Sonia's mother said, "Stop discussing body fluids at the dinner table." Her mother's partner Heidi also added, "Good kids don't need to know about HIV and AIDS." All right, so what do you think? What are the facts from this story? Do you think that Sonia and her brother are correct about how HIV is spread? Why or why not? Do you think Heidi was correct in saying good kids don't need to know about HIV and AIDS? Why or why not? What do you think? Take a minute to respond. And now I will give you a little input here. So the facts are, we know that Sonia has been learning about HIV in school. We know that some of her friends have some misinformation about how HIV might be spread. Sonia brings it up at the dinner table, and her mom's not comfortable talking about it. And mom's partner, Heidi, says that they don't need to know about HIV. Good kids don't need to know about it. All right, question 2. Do you think that Sonia and her brother were correct about how HIV is spread? Why or why not? If you said yes, that would be the correct answer. Basically, everything they said was correct in the story. So yes, that's correct. How about the third one, though? Do you think Heidi was correct in saying good kids don't need to know about HIV and AIDS? Well, I can't tell you what the right answer is. There's not necessarily a right or wrong answer, but I can say that it never hurts to educate yourself about an illness like HIV and AIDS and get some good information. For example, how can you become infected, and how can you prevent it, and how can you treat it? All right, let's continue through the lesson. So in this lesson, we'll be covering the magnitude of the AIDS epidemic. We'll learn about the body fluids that can transmit HIV and how they would need to get into the body to cause HIV infection. And we'll also cover the medications that can be used to treat HIV. All right, so starting on the bottom of page 39, you need to know what the letters HIV stand for. H stands for human. HIV is a disease that we find in humans. We can't get it from other animals. We can get it from infected humans, and an infected person can give it to another human, but not animals. I stands for immunodeficiency. This refers to our immune system, the system in our body that's supposed to fight off diseases, becoming weak or deficient. And the V is for virus. So that is the type of illness that HIV is, as opposed to like a bacteria, for example. So a virus is a very, very small living particle. We can only see through a microscope, but it can cause very serious infections. All right, top of page 40, you need to know what the letters AIDS stand for. A stands for acquired. Acquired means that we have to get it from another person. It doesn't just show up in our own body. I refers to immune, and that's our ability to fight off infections. The D is for deficiency, so similar to the I in HIV, except now we're just splitting it into two words. So the immune system is weak. And the S is for syndrome. Syndrome is just a combination of signs and symptoms that represent a particular disease. For example, if you had a sore throat and a stuffy nose and a headache and a cough, you're showing signs and symptoms that you might have a cold or a flu, right? So there's very specific signs and symptoms that would represent AIDS. All right, let's talk about some numbers. How common is HIV in the world? Worldwide, there are about 1.7 million new cases of HIV in 2018. About 37.9 million people are living with HIV all around the world, and that was as of 2018. As of 2016, 1.9 million people living with HIV were receiving ART, which is antiretroviral therapy, or its medication. So that's awesome, almost 20 million people, but we've got almost 38 million people that have HIV. 38 minus 20, what are we left with there? That's a lot of people still living with HIV, but not receiving any treatment at all. So that's sad and that's scary. That's about 18 million people. And the reason why I'm saying that that's sad and scary, because people today that have HIV and are taking medication are living so much longer than back when this whole virus came to become the pandemic, the epidemic that it is. This is a map of the United States, and you can see where we have the darker colors are where we have the higher rates of HIV diagnosis in the states. So you can see down here in Florida and up here on the East Coast, we've got some real dark red. California is dark, but it's not the darkest. In 2018, almost 38,000 people received a new HIV diagnosis in the US. About 1.1 million people in the US were living with HIV at the end of 2018, and 86% of people with HIV knew they had it, which means we still have 14% of the people that have HIV have no idea that they have it. They haven't gotten a test. They could be infecting other people. Unfortunately, they could pass away because of this virus because they're probably not getting treated for it, obviously, if they don't even know they have it. So of these 37, almost 38,000 new diagnoses in the U.S., statistically, 69% of those new diagnoses were among gay men and bisexual men. 24% were among heterosexuals, and 7% were among people who inject drugs, so they share drug needles. All right. It is important for people to know their HIV status so they can take medications to treat HIV if they have the virus. So I just mentioned that about 14% of the people in the US that have HIV don't even know they have it. If they were to get a test and test positive, they can take medicine. Taking HIV medicine every day can make the viral load undetectable. People who get and keep an undetectable viral load or stay virally suppressed have effectively no risk of transmitting HIV to another person that doesn't have HIV negative sex partner. That is huge. So what we're saying is somebody with HIV can potentially take medication to decrease the viral load in their body and pretty much eliminate themselves from passing it on to another person sexually. So again, it's very important to get tested. All right, let's come a little closer to home. This is in California. Again, the darker areas represent where we have the higher numbers of people diagnosed with HIV. So we have the highest numbers in San Francisco, also in LA and Santa Cruz. In 2018, there were 136,566 HIV and AIDS cases in California. So that's the whole state. Closer to home, as of 2018, there was 362 people living with HIV or AIDS in the county. And to give you some reference, as of the new census data for 2020, the population of Placer County is 404,000. All right, so let's talk about the virus and our immune system. So first of all, the virus, any virus or bacteria, gets into our body. Let's say somebody sneezes on us, they have a bug, a virus enters our body that way. Our immune system starts making T cells, and T cells in the bloodstream start to fight off this infection. Our immune system makes antibodies to help fight the infection and prevent future infections. Okay, so we get a virus, we make T cells, we make antibodies to fight it off, and we get better. That's what normally happens. But when we get infected with HIV, it works a little bit different. So HIV takes over the immune system and starts to produce more HIV. And then our T cells, which are supposed to fight off the virus, actually become HIV factories. We still make those antibodies. In fact, when we get an HIV test, that's what we get a test for, the HIV antibodies. But they aren't strong enough. Our immune system is so weak, they aren't strong enough in most cases to completely get rid of it. Those antibodies take a few weeks to show up. So a person infected today won't test positive for HIV for at least 3 to 12 weeks. Okay, I mentioned ART earlier. ART stands for antiretroviral therapy. This is medication that slows the progression of HIV in the body. I'm now on page 40 if you're following along. ART keeps an infected person healthy for many, many years. It decreases the transmission of HIV to sex partners. A person can take something called PEP, which means post-exposure prophylaxis. This is given immediately after a possible exposure to prevent HIV infection. So PEP, the post means after, right? After you were exposed, this is a medication to take. An example could be a person was having intercourse with an HIV positive person and the condom broke. So they could take PEP immediately, as soon as possible, after that possible exposure to prevent becoming infected themselves. And death rates related to AIDS are decreasing. All right, there's another medication called PrEP, pre-exposure prophylaxis. So this is a medication you would take before you are exposed. Well, why would you do that? Well, some people are at high risk for becoming infected. So this is for people not infected with HIV, but are at high risk of exposure. So possibly this could be a person whose spouse has HIV. They don't have it, but their spouse does. Or maybe somebody who works with HIV or AIDS patients. Or maybe somebody's a prostitute. They don't have HIV yet, but they are at high risk of getting it. So they could take a medication like PrEP. It keeps the virus from establishing a permanent infection in the body. It has to be taken daily. When taken consistently, PrEP has been shown to reduce the risk of HIV infection by people who are at high risk by up to 92%. That's pretty awesome. And because you are taking a medication regularly, it is important to also regularly visit your doctor and have all your blood work done and make sure that everything is good. And remember, condoms are the only method of birth control that will protect against STIs other than abstinence. All right, so let's take a look at this picture here. So we have over here in the bottom left corner, this would be when a person gets infected with HIV. Okay, so then it takes 3 to 12 weeks before a person makes enough antibodies to show up on a test. So this is our antibodies level. Okay, and if we have antibodies show up, that means we have been infected and we have HIV. Okay, we call this time frame the window period because we could have become infected. We can infect other people if we truly were infected, but we still might not test positive yet. It might take, that up to that 12-week point to test positive. So you could, do you have HIV? You don't know. You might. You could pass it on to other people. So that's, again, another reason why it's so important to take care of yourself and to get tested. Another thing that might show up in the beginning is developing flu-like symptoms. So that might last for a few weeks, and you might ignore them. You might just think there's a bug going around and you got it. So maybe if you didn't think you had any reason to become infected, you never got a test. Let's see, what else here? So then a person can live for years and years and years and never even know that they have HIV. Or maybe they have been tested and they're on medication and they can live for years healthy. But somebody who hasn't been taking medication will probably have their immune system start to become weak. So down here at the 7, 8, 9, 10, 11-year point, it says AIDS is diagnosed when a person's T4 cell count falls below 200. So I believe, I want to say normal T cell count is around 12 to 1400. So when it drops below 200, that's when a person is diagnosed with AIDS. That's one of those very rare symptoms or signs that we use to diagnose a person with AIDS. Another item that we would use to diagnose a person with AIDS is the development of what are called opportunistic infections, which are very rare illnesses that we only see in people with very weak immune systems. So at that point, at this point, a person hasn't been taking care of themselves. They are not on medication, likely. They've now been diagnosed with AIDS, and their immune system is very weak. At that point, it may be only a matter of time before their life ends. But with medication and treatment, a person can live for years happy and healthy with HIV and not even infect anyone else. So how is HIV infected? On page 41, I would like you to write down the body fluids that can transmit HIV. So those would be blood, breast milk, semen and vaginal fluids, and rectal or anal fluids. So those are the only 4 fluids, and those have to come obviously from an infected person. So an infected person's blood or breast milk or vaginal fluids or semen or rectal fluids can transmit it to another person. But those fluids have to get into an uninfected person's mouth or openings in the skin, like cuts or breaks in mucous membranes, in through the genitals or into the anus. Those are the only ways a person can get infected. All right. At this point, we would typically do an activity where I would give you a body fluid and a body opening, and we would try to figure out whether that could possibly result in HIV infection or not. So, for example, an infected person's blood into their ear, would that result in infection? No. How about an infected person's breast milk into another person's mouth? Could that result in an infection? Yes. So that is one of the reasons why pregnant women that have HIV, once they deliver their baby, they would be encouraged to formula feed their babies as opposed to breastfeeding their babies. Okay. All right. All right. And due to our circumstances, we're not going to do this activity either. But let's cover the wrap-up questions. Number 1, the AIDS epidemic impacts men, women, and teens. True or false? True. Number 2, HIV prevents the body from being able to fight off infection. That is true. Number 3, body fluids which can spread HIV include blood, semen, vaginal fluid, and urine. That is false. Urine does not transmit the fluid. Number 4, the goal of antiretroviral therapy, or ART, is to extend the infected person's life by keeping their HIV viral load low. And that is true. All right, so I'm wondering, what is the most important or interesting thing you learned during this lesson on HIV and AIDS? Ask yourself, how committed are you to avoid behaviors that spread HIV? Ask a parent or guardian or trusted adult to review this information with you and tell you how old they were when they first heard about the AIDS epidemic. And what did they hear? And I will tell you that in the beginning, it was very scary. We didn't know a lot about it. We thought it was very infectious amongst certain population groups, and we didn't have the same quality of medications and treatments back then that we do now. So it was definitely scary. I remember personally hearing about stories of people finding hypodermic needles, like drug needles, in the seat of at a movie theater, and people were so scared something like that made the news. And we were just wondering, did somebody sit on that needle? Did that needle have AIDS? Those were the sort of things that people were scared about. Now we know so much more. We know we can only get it from those few body fluids, and there's a lot we can do to protect ourselves. And that concludes Lesson 7 on HIV.